Thanks a lot. So, dear colleagues, researchers, students, and partners, dear all, it is my great pleasure to welcome all of you to this year's Global Health Symposium, co-hosted by Copenhagen Center for Disaster Research and the School of Global Health, here at the University of Copenhagen and supported by the Novo Nordisk Foundation. I am thankful that so many of you here are to engage with this year's important topic, extreme heat and health in the context of climate change. For my welcoming address today, I would like to convey 3 key messages. 1, the climate crisis is a global health crisis, which we must address. And second, we cannot address this crisis without interdisciplinarity. And the third, the health sector and the health science community carry a responsibility. So climate change is now a concrete reality affecting people's health here and now. In Denmark, but far more in the regions of the world where temperatures often exceed what the human body can tolerate. We see it in extreme heat waves that claim tens of thousands of lives globally each year. We see it in the rising incidence of cardiovascular disease, dehydration, respiratory diseases, and mental health burdens, all linked to heat. And we see it in the rising inequalities as the most vulnerable groups are hit the hardest. Older adults, children, agricultural workers, and people in low-income countries where health systems are already under strain. All of this reminds us of a simple truth. Human health depends on the health of the planet. When our climate ecosystems and living conditions are under pressure, so are we. That is why, as the Faculty of Health and Medical Sciences, we have a responsibility to bring knowledge, data, and solutions into play. And I am proud that so many of our researchers already contribute to this work, studying these challenges from different angles and across disciplines. Be it research on heat waves, air pollution, food and water insecurity, or the migration and conflict that can follow. And when biodiversity is degraded, it affects drug development, disease patterns shift, and new zoonoses can emerge. Which leads me to my second message. We cannot address the climate and health crisis without interdisciplinarity. The challenges we face do not fit neatly within the boundaries of any single field. Climate change affects physiology, behavior, health systems, infrastructure, and society. And therefore, we must work together across disciplines and sectors. I'm so pleased to see that this symposium supports this way of working, with such an inspiring lineup of keynote speakers and panelists from different backgrounds, and different modes of engagement that will bring together colleagues to share knowledge and ideas at the intersection of climate and health. I want to thank you all for participating. Your contributions here help us strengthen our understanding of the health consequences of climate change. This work is essential for building the evidence we need to develop climate-resilient health systems and to prepare our health professionals now and in the future to a changing world. And to my third message. The health sector and health science community carry a responsibility to understand and to act on the consequences of climate change and to change our practices to reduce our own climate footprint. We have this responsibility towards our students. When I meet them, I sense a strong engagement and hope. They understand that climate and health are interconnected. They want to take part in sustainable change, and they expect us, as an institution, to take responsibility and lead the way. It is an expectation I fully share. As a university, we have an obligation not only to educate skilled professionals, but citizens who can think sustainably, act responsibly, and contribute to a better world. At the Faculty of Health and Medical Sciences, we are working purposefully to integrate climate and sustainability into our core missions, in our research, our education, and our societal engagement. Our vision is clear, that our students, whether they become medical doctors, dentists, veterinarians, pharmacists, public health professionals, or researchers, should understand how their field can contribute to more sustainable development. And we are committed to promoting research that brings climate, sustainability, and health together, because the solutions we need will be found where these fields meet. We have allocated resources to support this. Through our program So Collaborates, we have established seed funding for planetary health projects that promote interdisciplinary initiatives connecting health, climate, and environment. We have established a working group on climate and sustainability in education, which is supporting the integration of sustainability into all our study programs. A process in which researchers from the Department of Public Health, among others, has made an essential contribution. And we are working to better equip our educators to do this by drawing on the knowledge already here and by sharing cases and experiences across disciplines. Beyond research and education, we must also dare to question the example we set ourselves. The health sector itself is a significant consumer of resources and a source of vast CO2 emissions, waste, and environmental impacts. If the global healthcare system were a country, it would be among the world's 5 largest emitters of greenhouse gases. Sustainable healthcare, therefore, is not only about adapting to climate change, it is also about changing our own practices and sharing solutions with each other globally. We must think differently. How can we reduce resource use in hospitals and laboratories? How can we prevent more and treat more wisely to avoid overuse of medication and unnecessary interventions? How can we design healthcare systems that are both climate-friendly and socially just? These questions are not easy, but they are necessary. For my closing remarks, I would like to reiterate: climate change is the greatest threat to human health in the 21st century. But it is also an opportunity to rethink health as part of a sustainable future. The Global Health Symposium is precisely about this, connecting the newest knowledge on extreme heat and health so that we can identify sustainable courses of action. I hope that today you will be inspired, but also challenged, that you will share your experiences, build new alliances, and plant the seeds for joint solutions that reach beyond the walls of the university. Thank you again to the people in the Copenhagen Center for Disaster Research and the School of Global Health for hosting this symposium. And thank you to the Novo Nordisk Foundation for supporting the symposium. Thank you all for being here and for contributing. I hope that you will have some inspiring days together.